The USMLE is a set of examinations a doctor must pass before being granted the right to practice in the US. It must be taken by both US graduates and international medical graduates. Unlike USMLE, PLAB is a medical licensing exam required only for international medical graduates to be given the right to work as a doctor in the UK. The USMLE consists of 4 different exams: Step 1, Step 2 Clinical Knowledge, Step 2 Clinical Skills, and Step 3. Let's discuss this one by one. USMLE Step 1 is an 8-hour written exam made up of a maximum of 280 multiple-choice questions, divided into 7 blocks, lasting 60 minutes each. This exam focuses on basic medical sciences. Step 2 CK is a 9-hour written exam made up of a maximum of 318 multiple-choice questions, divided into 8 blocks, lasting 60 minutes each. The exam focuses on common clinical medicine. Next is Step 2 CS, which is an 8-hour practical exam made up of 12 patient encounters, lasting 15 minutes each. At present, the USMLE program suspended the Step 2 CS exam until at least June of 2021. In line with this suspension, they have provided pathways for IMGs who have not passed Step 2 CS to meet the requirements for ECFMG certification, which is essential for US residency application. Also, a satisfactory score on OET medicine is now required as proof of English fluency regardless of the pathway you are eligible to take. Note that these pathways are for IMGs who intend to enter the 2021 matching process. You can check out ECFMG's website for current updates. Lastly, Step 3 is the final part of the series of exams which is not required prior residency application. It is usually taken after first year of residency, so we won't discuss this for now. PLAB, on the other hand, is composed of 2 exams called PLAB 1 and PLAB 2. The first part is a 3-hour written exam consisting of 180 multiple-choice questions. This exam focuses on common clinical medicine. Note that you must first pass either IELTS or OET to be able to sit for PLAB 1. Meanwhile, PLAB 2 is an objective structured clinical exam made up of 18 scenarios, each lasting 8 minutes. This exam aims to assess your clinical knowledge and skills by simulating scenarios in real-life settings. The scope includes topics, skills, and procedures that a physician should know and be able to do. Again, these are the following exams for USMLE and PLAB. It is important to note that you can take the Steps 1 and 2 exams in any order. But this is not the same for PLAB, where you have to pass PLAB 1 first before taking PLAB 2. Step 1 and Step 2 CK can be taken in other countries aside from the US, while Step 2 and 3 are only offered in the US. Meanwhile, PLAB 1 can be taken in many places aside from the UK, whereas PLAB 2 is only taken in Manchester, UK. The fees for the USMLEs are as follows. If you plan to take the Step 1 and 2 CK in your home country, there is an additional international test delivery surcharge of $180 and $200 for Steps 1 and 2 CK respectively. Here are the fees for PLAB exams. From this, it is clear that the PLAB exams are cheaper versus that of the USMLE. Preparation time for USMLE usually takes around 2 to 3 years on average, whereas a year or less of preparation for PLAB if you pass everything in one take. After passing the STEPS exams and completing all the necessary requirements like ECFMG certification, you can now apply for residency in the US in a process called the match. Basically, passing the STEPS exams do not give you a confirmed slot for residency programs as you still have to be matched with the program that you desire. And this doesn't come without a cost. The fee for applying for up to 20 programs is $85, and if you want to apply for more, another $30 fee should be paid per program. After passing the PLAB, you can now apply for GMC registration, which grants you the right to work as a medical practitioner in the UK. Unlike USMLE, PLAB will not make you eligible to apply for training or residency program right away. You still have to meet the person specifications criteria of the specific specialty training pathway you want to pursue. When you apply for specialty training, you won't be charged anything. In cases where you are not fortunate enough to enter a training pathway, there are non-training posts offered in the UK where you can apply for jobs suitable to your previous experience and qualifications. While comparing the information given, PLAB is seen as an easier path because of the shorter preparation and less exams to take. USMLE, on the other hand, requires more preparation time and intensity. It is also worth bearing in mind that failing one of the PLAB exams do not have a long-term negative effect on future job applications. Meanwhile, failing a STEP exam will reflect on future job prospects. Another obvious fact noted here is that the overall cost of the exams are greater for the USMLEs than PLAB.